Good day. This is Dr. Siciliano coming to you from my office in Mayetta, New Jersey. Today I want to talk about the Cox 8 and the Cox 8 force table and some of the presets and commands that you can give to the table so that you don't have to bend over and go to the control box at all. First I want to show you the calibration commands that you give to the table. This should be used maybe once every 6 months to calibrate the table, make sure it's accurate. What you do is just follow commands, and the table will go through a system of motions and will calibrate the table to keep it accurate. We also want to show you some presets where you're able, these are the preset commands where you can preset the table to, when you put it into the auto mode, that the table will go the time and travel settings to that setting, okay? So I'm going to include this in your notes. Both of these will be in your notes. So once you input this into the table, and Jackie's going to go to the control box, okay? So as I put my table into auto, it will go to my presets of time and travel, okay? Time is here is about 1.5 minutes. Travel is about 3/4 of an inch. And you can then move it from that point in time if you want to, okay? I want to go over how to engage traction from the tiller bar. So what I do is I put my table into my presets, okay? And then we go to tension up, silver button, and that will give you time and travel. That's my preset right there, okay? If you want to, you can put the delay function in, which is column up. For every time you press, it'll be a 1 second delay. So I press, 1 second delay. If I press it again, it gives you 2, okay? Up to 6 seconds. If you want to reduce it, you press column down. Again, and now we're back to the regular setting, and to come out of it. Now to do pull to force, first you want to set the force, your desired force that you want the table to pull to, and once you have that, you go into the auto mode, and then you do column up, silver button, and that gives you your pull to force traction. The Cox 8 force table has 2 types of traction. It has pull to force traction, and it has time and travel traction. And then you go into your delay. I usually use 4 seconds. So the table will hold for 4 seconds and then go back. This is right now, it's set to 40 pounds. So it's pulling out, nobody's on the table. So pretty much that's what you're gonna get. We go into manual mode, and it's gonna go back to neutral. Okay, so when we want to do, if you're doing flexion distraction and you want to check the tension on the caudal cushion before you start to treat the patient, what you do is you look down at the travel lights here, okay? And that will give you an indication on where the tension is. Now, if you want to change it, you go to auto, and you can change that, okay? But what I wanted to tell you is that this will tell you how much tension is on the caudal cushion. So if you want to increase the tension, you just push the tension up, okay? You want to go down, tension lights go down, okay? you will get a feel for how much tension should be on the caudal cushion. Usually it's about 7.5 to 10 in this area, but it's simple to do. And then of course you still have to have your knee under the caudal cushion so it doesn't drop. But this will give you an indicator on how much tension is going to be on the caudal cushion. Okay. Now when you're in traction, okay, or in auto, and you want to initiate traction, but it's not the desired time or travel that you wanted, you do not have to bend over and go to the go to the control box. You can use tension up to change the setting for time, and you can use column up to save the settings for travel. So, and then you initiate your time and travel. Now for pull to force, really doesn't apply because you're pulling to a force. You're not pulling to a distance or for a length of time. Potentially with pull to force, if you want to reset the time, okay, you can use the function. You just put it in auto and use your tension up to increase or decrease the time that you want it to do. Okay. Now to lower the table, this is one of my favorites. Okay, you're done treating a patient. What you want to do is put the table in auto. You press tension down, silver button. You can hear the tension on the table reducing, and the table just goes down to pretty close to normal or to low. Okay, and the patient gets off the table. Okay, we want to do one last thing, okay, before we go to the graph. This is a quick set item where if we want to go into manual, okay, so you know where the patient has been in before, you know their settings, okay, their tension and the height of the table, which be tension would be time, height of the table would be travel. So let's say it's a 7.5. You go to 7.5, the light's blinking, and this will go up to 2 minutes. Okay, these are your presets on that particular patient. You hit start, and so the tension is set on the caudal cushion that patient had last time in, and the height of the table goes to where you want it to be. Now we're going to go over to the graph on the screen here. Okay, this is step back just a little more. Show the whole thing. Yeah. This is a desired graph, in my opinion, that we're aiming for. You can see that the long Y force and the hand force, those two lines are pretty much on top of each other, and you can see the flexion angle as it gradually increases. So we want to get a little closer. So your hand force, and we started out about 7 pounds. That's hand force. Distractive force was pretty much the same. Okay, and as we go halfway through the graph, we've gone up from 7 to 8.9. Towards the end, we're at 10.99. So we went from 7 to almost 11, an increase in the amount of force that we were able to apply as the spine became more flexible and pliable. So we were able to apply more force. Okay, from the taut point. You see flexion angle here. This is pretty much where your taut point's going to be at. This is like a times 10 degrees, so you have to move the decimal point over to the left by 1, so it's 1.19 degrees. So as we're coming here to the middle, we're at 2.49 degrees. and towards the end it's 2.77. Basically what this is showing is, as we had increased amount of force applied and increased flexion angle, this occurs as the spine becomes more flexible. We're always keeping in mind on where your taut point is. Okay, now the question I'm going to leave you with today is, come on a little closer here, is on this particular graph, which I actually did today. The magenta line or pink line will show the difference between your hand force and your long Y force. So the difference there would be 0.9 pounds. So it's less than a pound. But you can see how it's about the same. And that was, it was pretty consistent, but it was just gradually under a pound, 0.8, 0.9. But the margin of error is that, in my opinion, and my discussions with Dr. Cox over the years, was that you're better off having a little more long Y force than hand force. And you don't want to lose the taut point, because when you go past the taut point and go into back to where neutral is, you start to get compression. So the discussion I want you to have at today's seminar is compression, decompression. What I've talked with Dr. Cox and with Terry, the engineer extraordinaire from Haven, is that you get to taut point, and the treatment starts from taut point past that. When you return from your flexion distraction cycle, you don't want to go past taut point. You'll know that with the force table, because you will go into negative thoracic force. So as long as the thoracic force stays positive, okay, stays positive, you're good. You're within the margin of error. And ideally, that's where you want to be. When you start to lose that, and it goes negative, then you're going into compression. So this is a discussion I'd like for you guys to have. I've discussed it with Terry. Dr. Jim's given me his opinion, and I thank you for the opportunity to do this presentation. Thank you.